everyone, my name is John Hoolahan. I'm from Long Island, New York, specifically East Northport is where I grew up. And I graduated from URI College of Pharmacy in 2019, which feels like eons ago, but it's kind of recent. Yeah.
Yeah. So why did you pick URI? What about the pharmacy program really stood out to you?
So yeah, I'll never forget the first time I met Denise. I went to like an accepted students day, and the selling point, like the moment I was like, okay, cool, I'm coming here, was the option to study abroad. I talked to Denise about like, is this possible? Do people do this? And she overwhelmingly encouraged that I could do like whatever I wanted to do and still be a pharmacist. So, they didn't really like deter me or be like, you have to study like all the time, which we do, but but it felt good to know that, there were other opportunities. I did apply to some schools in New York where I'm from, but a lot of them were either really, really far away upstate. So URI was closer than a lot of schools to where I grew up. And the financial aid was much better than a lot of the New York schools because a lot of them are like private universities or, so I went to URI for financial reason and basically to study abroad, which was such an amazing experience. I'm so glad I did that. And yeah, as far as the pharmacy program goes, I didn't really know too much about what I would walk into until it was happening. But I will definitely say there was a gut feeling. And I'm very, I trust my gut more than more than a lot of things in my life. So it just felt right.
I love that. So you have to talk about study abroad because that is one of our main selling points as a school is that we do encourage our students to study abroad. So where did you study abroad? What was your favorite thing? Do you miss it every day?
So I studied abroad in Florence, Italy. Italy is like a super amazing, magical place to me. I love the culture. I love the food. I studied there my spring semester sophomore year, which I think is pretty typical for when that fits in the pharmacy schedule. I was there for like over 3 months. I got to live in an apartment in Florence. I met amazing people from different schools all over the country. And I got to, get more proficient in Italian. I do like studying the language. I like speaking the language. I got to take some cool classes. I took an art history class taught in Italian in like the city where the Renaissance happened. So there's a lot of like just really old, cool, amazing stuff. You could go touch a building that was like 1,200 years old, some crazy thing like that. Everything was just like, it's been there for so long and it has such like a, it's different when you study something in a textbook and then you go there and you actually see like, this is where it happened. So super amazing. Definitely like peak college experience was studying abroad. And then coming home to P1 year is definitely an adjustment. And I do miss being abroad, but I would do it over again the exact same way if I could. And I took a food and wine course. I know people like to hear about that. I took pairing food and wine as one of my fine arts credits. So because I took that class in Italy, I was able to graduate. I did meet one of my requirements. It was just amazing. Every day was awesome.
Oh my God. Everyone talks so highly of the Florence program, and I love like hearing the stories. I'm like, oh my God, I would have just ate my way through Italy. I would have done nothing else.
Yeah, and you eat so much pasta and you walk everywhere that it's like you still like shave off a few pounds. It's crazy.
Yes. Yes. That's how it was in France. I had croissants almost every day. I didn't
Mhm.
let myself have them every day because I was like, that's a little too much, but almost every day. And I came home and I was like 3 pounds lighter. I was like, yes.
Yep.
I was like, this is the best decision I've ever made.
Yes.
I wish. Oh my gosh. I know. It's hard. I feel like once you go and you experience that and you actually have the experience of living in Europe and, walking through the cities and seeing those things that you only hear about or read about in textbooks. And then all of a sudden you're living that life to come back here and actually do your P1 year and to be thrown into working and school. And I'm like, oh, the depression was real. that like
Yeah.
that
Yeah,
fall
it's definitely a
semester,
struggle.
I was so sad.
Mhm.
It was tough, but definitely well worth it. So what else were you involved in with URI? Did you do any clubs or organizations?
Yeah, so my freshman year, I was in the marching band. I played alto saxophone, and it's something I was really into in high school and middle school. So when I got to URI, I didn't want to let it go. So I did one semester of marching band. I didn't follow it through just because it wasn't the right group for me, and I wanted to have weekends for me. So I let that go. I did pep band that same year, so I got to go to some of the basketball games. That was really cool and really fun. It was fun to be part of that, like, URI spirit thing, especially as a freshman. You get to meet people like right away. With marching band, you got to move in like a whole week and a half like earlier, and you get to move in to your dorm kind of first because you had to practice before the season started. So a little advantage there. Um, Besides that, while I was in pharmacy school, I was in AMCP, Academy of Managed Care Pharmacy. Um, so I learned a little bit about like how the whole like finance side, insurance side, NTM, managed care pharmacy is like kind of a big umbrella term. Um, but that was really cool. Got to learn about like P&T committees and how insurance companies or whoever plan to add a therapeutic agent to their formulary or vote to take one away, or when new drugs out like comes out, what happens. um, I did a lot of yoga classes at the gym at URI, and then as I started doing my professional schooling, I did an independent study elective with one of the faculty members, Dr. LeMay, and we also were working with Dr. Buchanan to create a research project where students came and did yoga and meditation for 6 weeks. And we studied changes in stress levels pre and post. And actually, we got that research published while I was at URI. So I did not think I was going to be leaving my university a published researcher, but that happened simply because I found people at URI that really like believed in me and what I was passionate about and knew how to grow that out of me. So I'm super grateful for all the faculty that I met at URI. They really, really, know how to stoke your fire in the right way. So yeah, advice, pro tip. The professors are there to help you, and they are not scary. So, it kind of can be intimidating when you're sitting in lecture hall and they're like so smart and they're like telling you all these things and you're learning all these words you've never heard before. But if you're feeling like you need guidance or support, they're always there. And if there's a teacher that you personally feel like you would resonate with, um, making that bond, opening that doorway of communication with them is something that really, really helped me kind of get through the program. And not only get through it, do it in a way that I was able to put my love into what I wanted to um, put my energy into, and see that you can be a pharmacist, but also, create your own lane within the practice. So that was really awesome. What else did I do? I was in a club called Thrive, which was like an entrepreneurial based club. I don't know if it's still there, but yeah, we basically were a group of people who really, really like to like work on projects, and we tried to throw a couple of events at the school, and that was fun. I met some cool people. I met one of my best friends through that organization. Kind of faded away and trickled away as some of the older people graduated, but met some cool people there. And yeah, I think that covers it.
I say you were very involved though. Like that's a lot of different programs, and especially like the research component. I love that. I love that you found a professor and did something you're very passionate about. I'm a huge proponent of it. I'm like, I tell all the new students, I'm like, find research, and they're like, I don't want to do research. I'm like, find it anyways.
Mhm.
I'm like, find a mentor. You just have to find someone that you really connect with. And you are, there's so many different professors and so many different specialties that it's so easy to find someone who has some, like, is interested in something that you are as well. So I love it for that. So you are a community pharmacist and you work at Green Line. So what inspired you or what led you to choose community pharmacy post-grad?
Yeah, so yep, right now I work as the pharmacy manager at Green Line Apothecary in Providence. I was interning with Green Line while I was in school. I didn't really start working in pharmacy until, my IPPEs started. I didn't have anyone in the family that was a pharmacist. I'm the first healthcare professional in the family, so it wasn't inspired by, people I knew. I didn't know what the profession really was. I was guided to it by a teacher, my chemistry teacher in high school, which I feel like is kind of typical, but they kind of
Same.
identified that I was good or proficient at chemistry, and they were telling me about like, potential futures for that. So pharmacy came up, did a little research. Like I said, it just felt right in my gut, in my intuitive brain. So I kind of followed that. And community specifically, I fell in love with community practice. On one of my IPPEs, I worked at, was it IPPE or APPE? One of my experiences. I was
We have many.
Yes, there you go. There's plenty of places to practice, plenty of opportunities to get experience while you're in school. But I worked at an independent pharmacy in my hometown, and I really, really, really fell in love with like how everybody in the community gets to know each other. The pharmacist, I remember telling the pharmacist there, I was like, I'm so mind blown because pharmacists really like help to keep everyone alive month to month. Like there are lots of people, not that everyone's like on the verge of death, but a lot of people that take like life-saving medications and have a lot of stuff going on, with their health, and to be that trusted individual that kind of lightens that journey for them, or is someone that can, just be there consistently, because pharmacists are kind of the only health professionals, or one of the few that you see that regularly. So I really, really, yeah, I remember being very like meta about that because that was really cool to me. I was like, wow, like we are there for people all the time. So then I found Green Line when I was back at URI because I knew that they were into like a more holistic belief structure around medicine, which I was really, really into. I mentioned that I'm into yoga and meditation. I also am a Reiki master, so holistic modalities of healing have really helped me on my personal wellness journey. And as a pharmacist in the community, we are a resource for people. Like every day, someone comes in and they're like, I need help with this. I'm looking for something to help me with this thing that I'm doing. Or do you have any recommendations on how to do more than take my prescription, basically? So being able to have an expertise in recommending, whether it's like an OTC product or just like a lifestyle behavior, really, really lights me up inside. And I love talking to patients and I love sharing that information with them. And helping them be the versions of themselves that they want to be. So Green Line was right up my alley. When I met Christina, the owner, we kind of hit it off right away. She always says that she like cherry picked me out of URI to work there. And then, yeah, I found a place that I really loved. And then I was lucky enough that by the time I finished school, there was a position for me as a resident and then staff pharmacist and now manager. So yeah, I'm really grateful that I found good soil to plant myself in. And now I am, you know, growing into like a real big boy pharmacist. I'm like, wow, yeah, I've been a pharmacist for a couple of years now. And yeah, I love my job. I love being in the community.
Oh, you can tell every time I work with you, like you do. It's almost like you have like this goal. You love helping people. You're my go-to person for anything like holistic, any of the natural products. I'm like, John's got it. Like, go ask John. He knows. I'm like, John is like, you're such a great resource though, and especially for us as interns. I'm not a great medicinal product. Like, of course, I'm not the best. I always I try my best, but I'm not the best. I don't know as much as I should. I'm like, oh my gosh, John knows. Just go ask John. And but no, you just are so nice to everyone that walks in the door. I love it. I love watching pharmacists that are so passionate about community pharmacy and about helping the pharmacy and the people in the community and just being so involved. Love working with them. It like really shows, and you make the days lots of fun. And I don't like it. And I'm like, oh my God, I want to go home. But it's like, oh my gosh, it's 8 already? Like, wow, that was so fast.
I know, yeah. Yeah, even still, I'm like, oh, wow, okay. Even though they're long days, I mean, if people don't know, pharmacists in the community typically work long days. But they fly, they really do, because yeah, I am very social with the patients. And yeah, when you get to know someone that you're gonna see all the time and you get to know, you know, what's behind the prescription in their life, I think it's a way to reduce errors because, you know, you care about them, you know, like their kids' names, you know, what they're going through, you know, them as a human being, which helps you take better care of them. So yeah, I love community.
When did you get promoted to manager?
I think it was October of 2020.
Okay. Oh,
Yeah.
so during the pandemic. Oh, I missed that. I'm sorry.
That's okay. Yeah. I mean, yeah, it's my stage there, but that's when it was like official.
You were already manager, you just didn't have the official title. Is that what it was? You're like, I've claimed this. I love it. It's still you and Ryan though? Is Amy still working up in Providence or no?
Amy does a couple weekends,
okay.
Mostly in Wakefield right now, but yeah, me and Ryan are there.
I love it. They're like very like the male pharmacist and then the female pharmacist.
Yes, all the guys are up in Providence.
It is. It makes me laugh, but I love it though. Like it's such a different environment. So, oh, I love that. So, what is a typical day at work look like for you?
So, typical day, I get in at 8:15 a.m. I turn on the Script Pro, which is an automated counting and dispensing machine that we have at the pharmacy. And then I log into the pharmacy software. I pull up like the scheduling application, my email, where we order the drugs from, get myself all ready on the computer. And then we start processing prescriptions. So in the mornings, it's typically focused on preparing and billing, adjudicating claims for prescriptions that are automatically refilled each day for patients that subscribe to that service. In the mornings, we focus on getting prescriptions out for delivery. Our pharmacy delivers, well, between the two Green Line stores, we deliver to the whole state of Rhode Island, but at the Providence store in particular, it's very delivery focused. I feel like being in the city really bumps that up for us. So we focus on taking care of our delivery customers, brings a lot of access to medication to people in the community that may not be able to drive or don't have people that can go get their medicines for them. Phones ring all the time in the pharmacy, phones all the time. So fielding questions, talking to nurses, doctors, talking to patients, processing requests for patients, taking orders for refills. And while all that's happening, we're also receiving new prescription orders from physicians in the area. So people are going to their doctor for an appointment, then the doctor's sending a prescription, and then in theory, customer is going to come pick that up. So there's sort of that whole thing happening. And yeah, and then as the technicians and the staff working with me in the pharmacy, you know, physically prepare the prescription and put it in the bottle, then it shifts gears to verification, where the pharmacist is responsible for checking the validity of the prescriptions, the safety of the prescriptions, and just, you know, the overall clinical need or value of the prescription before it is released into the world, into the patient's body. So yeah, safety, lots of things going on, multitasking, organization skills. It's very dynamic and fun, fast-paced job. I like being in the community. I don't think I'm built for hospital pharmacy. I'm not like a sit down all day person. Not to like throw shade at hospital. I really
No, it's like you're not a basement pharmacy worker.
No,
Okay.
no, I need to
Okay.
like see the people, meet the people. I'm a people person. And yeah, TPN scares me. IV room, I can do without in my life. I'm good. I could do it if I had to, like I'm a pharmacist, but yeah, I'm not really looking to make that part of my day-to-day routine. So yeah, that's a typical day. And then we close at 8 p.m. So I'm there all day. I'm responsible for ordering all of the prescription products that we may not have in stock that day, keeping the inventory up to date, managing controlled substance inventory. Yeah, a lot goes into being a pharmacist.
It does. It's true though. There's so much that goes on in a community pharmacy that like you don't even realize unless you're in that setting and you're seeing it all happen. And like you said, like the C2 inventory, the monthly counts, and especially like with the robot and having to make sure that all of you have enough to fill the robot when it's empty. Oh yeah, there's a lot that goes into it. And of course, you're interrupted every 20 minutes with someone with a question. And
Oh yeah, and we didn't talk about vaccines, obviously.
How could I forget?
Yeah, that's a big part of community pharmacy right now. I mean, it has been, and especially in Rhode Island, but you know, with the pandemic and the vaccination efforts by CDC and just trying to get, you know, whatever's coming after COVID, trying to get there. Yeah, so we were doing clinics at the Providence store of like 200 people when we first started doing COVID vaccine clinics. Now it's part of like the daily workflow where we limit the appointments to like whatever's in one vial. So there's very little waste. I was reading an article today about how at some of the chains, like they're just kind of forced to open up one vial for one person if that's all that walks in that day. So yeah, managing also vaccine inventory and safely administering vaccines. And we do more than just COVID, we do like all of them. So yeah, vaccinating the public, ensuring safety of the public's prescriptions, being a resource for questions of patients or customers who want to know about medicine or how to help themselves. And all of that served with a smile, right?
That you can see most of the time.
I know, yeah. Even with the mask, it's in my eyes. Yeah.
It is. It is. Now, Providence is a very heavy, like Hispanic area. Do you speak Spanish?
I do not. My Spanglish is getting better, but we do have some Spanish-speaking customers at the Providence store. We have a technician who is fluent, and we do labels in Spanish. We, you know, basically give them the same service they would get elsewhere, which is really awesome. Yeah, pharmacy software is cool like that. You can do things like that.
It definitely is. My last one was at Athena's in Providence. I don't know if you're familiar
Mm,
with them. They're like an
mhm,
independent
mhm.
as well, and they just have like the one location, but it's a very heavy like Hispanic community. Like everyone speaks Spanish, and I showed up and I was like, "Hello," and they're like, "You need some Spanish." So I did. I learned the very basics of like pharmacy Spanish. And I told them that by the end of it, my goal was to be able to do like a vaccination, like appointment, but like a vaccination in Spanish, to be able to like ask the patient to sit down, have them roll their sleeve up, like which arm, and then ask them to wait for 15 minutes. Because when we did, I
That's
think it was like
amazing.
first, I think it was like the first vaccination clinic up in Providence. I came up and I was like helping immunize with you guys. And the majority of the patients were Spanish speaking. And I'm sitting here miming like, like wait for 15 minutes. Like I was, and then I had to pull Google Translate out. I was like, this is
Yes.
awful. I was like, I as a practitioner should be better. I should know at least the basics of this. But I did. It's Providence was really fun to work in. I didn't realize how much of a Spanish speaking community there is until I was actually like
Mhm,
in the middle of it.
mhm.
But I am miserable. They laugh at my accent. They're like, "You sound like a white girl speaking Spanish," and I'm like, "That's because I am a white
Yes.
girl speaking Spanish." I'm like, "I'm a white girl who knows French speaking Spanish." So like, the two languages aren't even the same. Like, they laugh at me and they're like, "Yeah, we
Uh,
know," and I'm like, "Okay, thank you,
yeah.
gracias."
Yes.
So no, it definitely is definitely an experience. But I think it's good though that you get to a wide variety of patients and a wide demographic that we help up in Providence. But
Yeah,
um
the vaccine clinics were part of like the governor's um, like plan or structure to vaccinate more, underserved populations, perhaps. So, um, yeah, we did that. We did that.
you guys did so many clinics. I remember like looking at the schedule and I was like, oh my gosh, they have so many clinics. You guys like rock stars. I love it. I love a good
Oh,
vaccination clinic. Like I can't stay away from them. Like that's my thing in pharmacy is I'm like vaccines. Like everyone should be vaccinated. Big fan of that. But so with community always comes the good and the bad. So how do you handle difficult situations on the job? And what advice do you have for those of us who are working in community or thinking of working in community when those situations arise?
Yeah. So yeah, community is interesting, right? Because we're pharmacists. We have clinically minded things going on all the time when we're looking at the prescription orders. But it's in a retail setting. So there's this whole capitalism influence of we need things fast, we need things now. The patient doesn't want to wait. So there is like that whole dynamic coming in with community pharmacy. And people kind of have that expectation of us, right? I do find myself saying sometimes like this is not a fast food restaurant. Your prescription should take, not a long time, but it takes time to make sure that, you're getting the right thing and that this is appropriate for you. I don't think people would want a pharmacist that is just like, okay, here, doctor said it, do it. Um, so yeah, there is some of that coming in, just the fact that it's a retail environment. But to your point about customer service and what happens when things get uh, bad or somebody has a bad interaction at the pharmacy, mistakes happen. They do. Whether it's you or another person working there, or that whole Swiss cheese model of how systems fail is a real thing. So there are going to be times where you have to have conversations about why was there a misfill of a medication, or why was your prescription not prepared on time, or why did we have to call the doctor to educate the doctor on the proper medication for you? Why can't you just have it right here in this moment? So there is a lot of like diplomacy and professionalism that you have to express in those moments, because at the end of the day, you're always looking out for the best interest of the patient. So, just reminding patients that we're doing this to help keep you safe. We're doing this to make sure that this is the best option for you. If somebody, is maybe angry or upset with you, or they're expressing those more emotional um, emotional qualities of their behavior, perhaps. Um, just remembering that people are going through something. There's a reason they're in your pharmacy, right? They are either dealing with a chronic disease that they've had for a while, or maybe there's a new diagnosis in their life. They just maybe got some not so great news from their doctor, and now they're showing up at the pharmacy where maybe they were told by the physician's office that something would be ready for them. Maybe they were told that it would be a very simple process, but the insurance company isn't paying for their new expensive medication because the insurance company dictates, what the patient is allowed to have. So if they get prescribed a new expensive drug, that delays sometimes the speed at which they receive the product, because we have to do an appeals process called a prior authorization and get the doctor back involved. So there are things that can cause, what's the word? Things that can cause a disruption in the flow of, patient goes to doctor, patient gets medicine, and that can frustrate people. So being able to educate them and let them know that, like, it's not a them thing. We're not doing it like to target them. Nobody's at fault. It's just the process, and this is the country we live in, and this is how healthcare works in America. So pharmacy gets to pull on all those pieces, right? Because we're so heavily regulated by all the three-letter organizations, all the three-letter bureaucratic agencies. We also are dealing with physicians that are like, I don't understand, I prescribed this, why can't the patient just have it? And then we're dealing with patients that are like, I pay so much money for my insurance, why are you telling me that the insurance isn't covering it? So we really have to be able to navigate all the complexities of medicine. It all kind of ends up in the pharmacy. So yeah, there's plenty of reasons why patients will get mad at you, and there's plenty of days where maybe that will be a consistent thing. But then there's going to be another day when everything's magical and you really help someone and make their day. And sometimes those conversations that you're afraid to have with people about, like, let's say there's a drug interaction you notice and you're like, oh, do I want to tell the patient? Like, like, what if I scare them? Making the effort and informing them and keeping them in the loop on what's going on in their treatment process about whatever they're going through. Actually, I have found it builds more trust, and they actually trust you more. So don't be afraid to have those hard conversations with patients if and when they arise, because being honest and being transparent with them about what's going on is always the best policy, and it really does help to build your relationship with them as their pharmacist, because then they kind of get it, like, oh, he's or she is doing this for my best interest. So I think that's important. And everyone that's coming to your pharmacy is going through something, like I said. So there's something behind the prescription, right? There's an emotion, there is perhaps a tragedy, there is perhaps a new illness behind the paper prescription or electronic prescription. So just keeping that in mind, it helps you be a little bit more empathic. It's not you, like, they're not actually mad at you. They're mad at the system. They're mad that they were told something else. And even if they're projecting that onto you, it has nothing to do with you. A book that I would recommend to all future individuals on Earth, but we'll talk about pharmacists today, is The Four Agreements by Don Miguel Ruiz. And one of the four agreements that the book encourages you to make with yourself is to not take anything personally, because at the end of the day, the patient is going through something that's making them upset, and if they express that onto you, it's really just a clue that they're upset in general. It doesn't really necessarily have anything to do with you or your character. So do your best to not take it personally if a bad interaction with a customer or patient happens.
Yeah.
It's hard.
It's hard. I have my moments, like, most of the time, like, I do realize I'm like, it's not me. It's not me personally. I didn't personally offend them or, you know, tell them that their baby is ugly. Like, I was like, I didn't say anything to them. It's the environment or other stressors, outside stressors that are affecting how they're treating me and the conversation that we're having. So, yeah.
Yeah.
But
Not
sometimes,
to encourage anyone to tolerate disrespect.
no, don't do
Boundaries
that.
are a thing, and absolutely, if someone is threatening you, or there's like a drug-seeking behavior incident, or there's anything, you know, that's a little bit more like dangerous, or you need to set a boundary, like you are totally in your authority to do that as well. This is like when you're a pharmacist, like it's your space and it's your temple of where medicine is coming out of, and if someone is not respecting that, or they're not um, able to comprehend that, or they're just there to get some extra suboxones out of you, or whatever, um, you know, those things happen sometimes too, and you know, you always are in control, you have the power. um, and yeah, luckily at my job we don't have too much of that, but I've heard, you know, stories of other pharmacies in other parts of the state or the world or the country, where things get a little bit more intense. And you know, crime and pharmacy is not uncommon. So just keeping an awareness around that you know, you're safe and you are doing what you want to do for the community. But if there's ever a moment where you feel like that is teetering into something else, you can always manage that situation as well.
Oh, yeah. No, it's a full sentence.
Yes, no
It's my
is
favorite.
allowed.
No, it's a full sentence.
Yeah.
But yeah, there's always going to be those patients, and oh yeah, we've got stories. It's almost like you have to like get the stories, and then the more like you're like, well, you know, this one time, this one patient. It's almost like you're swapping like war stories, like experience stories. Well, I had a patient. So it comes with a job, but it is just compassion. I think is like always where I go to. It's just treating each of them with compassion and understanding, um, and knowing that it's not personal. It
Hmm.
seems like it, but it's not. But oh yeah. So let's talk about all of your passion with holistic approaches, your yoga, and being a Reiki master. It's something a little bit different for pharmacists that we don't really see. So I'd love to chat with you about it.
Cool.
So how did you get into
So,
it?
yeah, so basically, when I was in pharmacy school at URI, we were learning about the central nervous system. So we were in CNS core. I don't think it's called core anymore, but we were learning about the brain and how the brain works, all the different neurotransmitters, and treating basically mental health through the pharmacy lens. Um, and at that time, I was going through a lot of interpersonal transformations. A lot was changing for me in my life. And I was seeking resources for my own mental health. And I remember being in class, and you know, every lecture at one point was like about serotonin. Like we just really drill like serotonin to death in the Western model of medicine, as far as like treating that whole thing goes. And there's so much more to it, and there's nuance, and new things are happening all the time. And yeah, the brain, I do agree, the brain is one of the last frontiers. We're still learning a lot about it. It becomes very evident to the students that we don't know everything, and medicine is a little bit of an art checked by science, because yeah, we're not 100% sure, and we can't say if you take this pill, your mental health problems will go away. Because I think that's dangerous. I think that belief in itself is dangerous. So I remember being a student and kind of not really vibing with this theory that, oh, I was just born with, you know, not enough serotonin and that's my issue. Um, there wasn't enough discussion, in my opinion, about what made someone's brain chemistry develop in that way. I feel that, yes, it's a chemical imbalance. Yes, we can treat it chemically with pharmaceutical agents. Sure, that works for some people. Um, but yeah, there wasn't enough conversation about, how did someone get to that point? What happened in the person's life that is causing depression? Did their mom just die? Or is it really appropriate to just like put them on an SSRI because of a trauma, like a short-term trauma? Um, yeah, I wanted more. I was like, there's more that we can do to help ourselves and for patients, because I wasn't buying the serotonin thing. I was like, there's more to the story here. So I took it upon myself to start meditation and yoga as a self-practice at home. And that kind of opened up a more holistic practice for me. I started to, gain better confidence and awareness about my own self. And then through that, was doing my whole like spiritual awakening thing that definitely happens in your 20s. When you're 20, like a lot of like veils are lifted and you're like, oh, this is what the world actually is like. So yeah, part of my awakening journey to what the world really is was finding Reiki, which is a natural medicine system. Reiki is a Japanese word that means spiritually guided life force energy. So it's a modality to help reduce stress that involves therapeutic touch and also energy medicine. So it's something that's definitely not really going to be taught in pharmacy school, perhaps anytime soon. It's different, but holistic or integrative health practices are something that pharmacists can totally bring into the wheelhouse, because like I was saying, when you're in the community, um, people are always looking for more than the prescription. They're going to ask you, what else can I do? So it's just so happens that for me, my own passions for what I wanted to do for me help me give recommendations to other people. So yeah, I found Reiki. I took 4 levels of training at a yoga studio called All That Matters down in South County, Rhode Island, near our school. I found an awesome, my Reiki master, my Reiki teacher, Myra, was such a blessing to my life. I remember when I met her, she was an older British lady, and I just remember her smile, and she was so happy and full of joy. And I was like, when I am that age, I want that. Like, I want whatever she has. She has something and I want it. So yeah, again, following what felt right for me. Reiki, meditation, yoga, all those things really helped me, dig myself out of where I was and move into what was next for me. And then, while I was at school, I met Dr. LeMay and Dr. Buchanan and other people there who shared a similar vision around being able to give patients more, knowing the value of holistic medicine, of mindfulness, and knowing that there already is data. They weren't telling me the story of like, oh, there's no data, like we can't talk about that, because there is. And not only is there already data, but I also had the opportunity to contribute to making more of that available to the world in small scale, perhaps underpowered studies, sure. But, I became really passionate about making an impact at URI because I knew all the other classmates that I was there with were going through something similar. It's really intense to become a pharmacist. There's so much schooling that you have to do. And you're in your 20s, right? That's when we're supposed to figure out who we are. Like, there's this pressure to like figure all your stuff out, get your degree, and there's not enough time to do all of that. So yeah, it can cause moments of feeling depressed or feeling anxious, a lot of test anxiety, and like, am I doing enough? There's a feeling of like perpetual, I have to do, and there's not, or before my time, there wasn't enough focus on like the rest and the human part of learning to become a pharmacist. So I was really passionate about changing that up. So while I was at school, we started like a wellness program where we offered meditation weekly and then yoga classes in the spring. Um, 2 of the semesters I was there, we did it as like a research project, so it was a little bit more formal. By the end of it, we got the teachers and students doing yoga and meditation in one room together, which was really, really awesome. And it was really great to like hear that this was helping not only the students, but also the faculty, because that really showed me that like, yeah, everybody is human. Everybody goes through these things, and holistic or integrative health acknowledges that and really helps make it a more rounded picture. Like, yes, maybe you need to take serotonin increasing drug for this period of your lifetime. But as a pharmacist, I feel passionate. I'm always asking like, you know, what's going on? Like, how are you? Because maybe they haven't had anybody ask them that to this point, and all they really need is someone to listen. I think listening is such a powerful medicine. And yeah, I could go on and on, but that is kind of speaking from the heart about all the holistic stuff that I'm into.
No, I love it. It's like such an integral part of you, and it very much factors into how you are, like what type of community pharmacist you are. Like, I think it's so important to talk about it. And I love your examples. They still do like, what is it? Mindfulness Wednesdays, I think it is, or Wellness Wednesdays.
Wellness Wednesday now. Yeah, yeah.
Wellness Wednesdays. So it is. There's you would love her. There's a freshman right now who's she's a yoga instructor, and so she is kind of taking over that, and she's holding yoga classes for a lot of like the students. And so she just did one in the greenhouse this week that I saw, and
Oh, amazing.
yes, you guys would totally hit it off. She's a sweetheart, and she is really just really taking an active role in our Wednesday program. So it's really cool to see that it's like continuing, and like Dr. LeMay still really supports it, and so it's really cool that that's still a thing.
Yeah, it's so awesome.
It's been 3 years and like it's still going. Look at that.
Yes, that means that it was needed.
Yes. And it is, and you're right. It's a very stressful time. It's a very stressful time.
Yeah, we didn't even throw like the layer of COVID on there, you know.
Oh goodness, no.
So
no, it's
so yeah, people are going through it, and they sometimes need more. And there's no drug interactions with meditation or yoga or Reiki, so it's gorgeous to me.
There's so many different like benefits to it. So I love it, and I love that you're so involved with it. It's really fun to learn new things for us. So I have like a couple questions. One of the next ones that I've got is, how do you see the role of the community pharmacist evolving in the future, especially post-COVID, now that we're kind of moving into a couple new things, especially like test to treat? How do you see this role evolving?
So yeah, I definitely can see point of care testing becoming like a big thing in community pharmacy. I don't know. Well, yeah, I'll keep my opinions for now.
We can talk about that after. We'll chat.
Yeah, I would definitely say that one, it's hard to imagine, right? We all kind of are still going through this collective trauma a little bit, and one thing that really was amped up and pharmacists were in the spotlight for was vaccinations. So that had like already been a thing, but I feel like pharmacy definitely, like, people were like, oh wow, like we're in the pharmacy more often than in the past, perhaps. And then, yeah, point of care testing, I think it was kind of becoming a thing. I know that some chains have like a minute clinic model, but I feel that there may be more of like a not full primary care, but it would be really cool to see pharmacy be able to kind of take the burden of the inundated primary care doctors and start doing things that we are good at in the pharmacy. So yeah, test to treat practices would be awesome. I know at Greenline, with the new residency program being revamped, we're going to start dabbling in some of those things. So pharmacy is already changing. And then, yeah, I mean, you know, every pharmacist dream is for provider status, right? We want to be able to do more with our license. I agree with Christina, the owner of Greenline, when she says every pharmacist is a clinical pharmacist. We don't believe in that word because, you know, there may come a day where you're in the community and you're going to be prescribing something. So kind of just, you know, remembering that we are doctors of pharmacy. So our expertise is in, you know, therapeutics, finding the appropriate agent for the disease state. And there are things like antimicrobial stewardship, flu and strep testing, especially infectious disease in the community, that I think pharmacists would be, it'd probably be like safer for the world if we took that over. Like, that's fine, we can have that now. And then, yeah, we're really accessible, right? People could just walk in, they don't have to make an appointment, which as the pharmacist is like, how do you do that in the workflow? You know, how can someone just walk in and like get what they need? But to change the model, we kind of have to break the model. So I think for medicine to evolve, pharmacy could be a really great place to implement new ways of advancing patient care forward, and, you know, taking that burden out of the doctor's hands and taking a bigger role in the what is it, patient-centered medical home, part of the team of people who take care of the patient, basically.
I love it. We can do so much, and a lot of the times we're very underutilized, I think, in certain aspects. So I'm super excited to see where it goes. I'm hoping prescribing like oral contraceptive comes sooner rather than later. I'm excited for that one. But testing to treat, I think, is it's a good step in the right direction.
Mm-hmm.
But needs a little bit more like work. It's a good step, so we'll take it. And then, of course, what is your favorite thing to get from the counter at Greenline?
Oh gosh.
I know it's so hard, and that's one of the unique things we have about working for Greenline, is that we do have the soda fountain. So what is your favorite thing to get?
Yes. So I like a lot of things. Before I was a pharmacist, I was a waiter at a Johnny Rockets for like 7 years. So I am merging my milkshake experience with my pharmacy world now at Greenline. So yeah, I am a fan of the coffee caramel milkshake. I mix those flavors together in one. Something that's really popular is having, well, you know, pharmacist drug of choice for me is caffeine. Love my coffee. And at work, we sometimes put a scoop of ice cream in there. That's really delicious. And then if I want something tangy, I go for the raspberry lime Ricky. Yeah, I became a lime Ricky fan.
It took me a while to figure out what a lime Ricky was. Yeah, like the raspberry one, like that's my like go-to if I need something like, I don't want like the creaminess, like the heaviness of like ice cream. I go for a lime Ricky. My go-to for a really long time was a root beer float.
Yum.
That was my go-to for the longest time. I think for like 2 years was root beer float, and then I've started moving out because I was like, that was a lot of ice cream.
I know, right? I know.
I remember, like, I think the first couple months I was like, I would get it after shift drink all the time, and you know, you're working 2-3 times a week. I'm like, that's a lot of ice cream. we gotta tone it down a little bit. But yeah, I do. I think I always get lime Rickies now. That's what I've gotten the last couple times, but it's been 4 years. I've worked for Greenline for 4 years.
That's awesome.
It's crazy.
I know, I've like
I'm not
lost
that
count.
old.
Yeah, you're tried and true. Um, yeah, I've lost count. Especially with the pandemic, I like still haven't even taken like my first big boy vacation from my job because I'm just like, I've been so in it, and now I'm like, whoa, like that was crazy. We did so much.
Dang.
But yeah, I do love my job. Can't lie.
It's a great place to work and it's a great like environment. So, and
Mhm.
then so my favorite question, which wasn't on your question list, I'm sorry, but I like to spring it on everyone because I like to see your like genuine response to it. Is what is your best piece of advice for any students who are thinking of coming to pharmacy school or any students who are currently in pharmacy school? What is your best piece of advice for us?
Mm. So, yeah, I definitely think it's important for anyone who's looking to become a pharmacist or go through that process to give yourself the permission to be a human along the way. Um, do your best not to get, bogged down by frantically checking for your grades. You're gonna have to rework expectations. Learning, being okay with failure. I did not leave with a squeaky clean record. I'm gonna put that out there. I remediated stuff like, there's gonna be times where you don't perform as well as you maybe used to do in high school or you used to do in undergrad. Um, and that's okay. Like that's so okay. Like life, for the rest of your life, you're going to be learning about how to like be the best you, and wherever you end up you're going to have to learn new stuff when you get a new job or whatever. So don't expect yourself to be an expert right away. That will help you kind of take a little bit of the pressure off, and it actually frees you up to do better if you're not like your own drill sergeant. um, and then other than that, find things that you love, because you're going to be breathing, eating, and sleeping pharmacy while you're in school. And it goes faster than you think. When you're in it, you're like, oh my God, I still have so much school, but it does go fast. And so holding on to, like, if every Tuesday your favorite show is on at night, like even if you have an exam Wednesday, ideally you'd be prepared before Tuesday, but like, giving yourself those moments of enjoyment and humanity and letting yourself kind of off the hook when appropriate is a really good thing to practice for pharmacy school, but also in life, right? Because responsibility is always going to be there. There's always going to be opportunity to take on more and more and more and do more and more and more. But remember that you are a human being, not a human doing. So your inherent value does not come from your productivity. It doesn't come from how much you can do. Just by being you, uh, you're good. That's all you have to do. So finding time to just be is my best advice.
I love it. That was like so cathartic for me too.
Oh.
But it's true. We're very much like those overachievers, and we try to cram everything in and try to do everything, and it's all about like, what can I do that like fills out my resume and sets me apart from other students, but not really like what am I doing for me? Self-care Sundays. Big fan.
Yes, exactly,
Should be
exactly.
self-care every day, but it's really not.
Yeah, well, once a week in pharmacy school that's good.
If you've got time once a week, I love it. I fully support
Hmm.
it.
Hmm.
I love it. Oh yeah. Okay. So before I stop the recording, do you have anything else that you wanted to add to our interview?
Ah, I
You
think
go
I laid
ahead.
it all out there. I think I
Okay.
laid it all out there.
You did. You were very honest and very open.
That's how I like to be. Um, so yeah, no, thank you for having me. Thanks for letting me chat. I hope this inspires people who are, passionate about whether you want to help people, whether you want to learn about medicine, whether pharmacy piques your interest for whatever reason, you can be you, and you can be a pharmacist, and the world will love you for that. So that's it.